My name is Goldman. I'm an orthopedic surgeon. I specialize in sports medicine, in particular shoulders, knees, and tendon injuries. The labrum is a lip of fibrous soft tissue that encircles the female side of the shoulder joint. It adds stability. Stability in the shoulder is done by soft tissue, not by bone. The labrum most typically is damaged by repetitive use in the overhead position, such as with a baseball player or a tennis player or a worker who's using a hammer or electrician, or it can be damaged by a sudden abrupt force, such as falling on your outstretched hand. The symptoms of a damaged labrum to the patient feels like aching, discomfort when the arm is used, particularly overhead position, reaching for something, lifting something, and sometimes something as simple as sleeping on it. Labral tears are classified by their location. The labral tears that are in the superior or upper part of the glenoid are called slap lesions, which stands for superior, labral, anterior, and posterior, and is a commonly used expression. Labral tears that are in the front of the shoulder are called Bankart lesions after the first doctor who described them. The most important factor in diagnosing a labral tear is, like most medicine, the history. The physical exam then plays a part, and if there is still question, imaging studies, such as with a magnetic resonance imaging scan, are done. Treatment for the labrum depends on the individual and what the demands that person has on his shoulder. In throwing athletes, for example, it's important that the labrum be reestablished. In the general population, it's pretty much age dependent. In younger people, if the labrum is itself healthy but detached, we repair it. If it's damaged, we remove part of it. Advice as to avoiding labral injury is somewhat problematic. Labral injuries are caused by unintentional falls, as I stated, so people certainly would like to avoid that. As to the repetitive source of injury, most patients wish to continue either playing baseball or tennis or their occupation, which requires lifting and working in the overhead position. So it's a bit difficult to just try and have any one plan to avoid injuring the labrum.